The Health and Medicines Committee met virtually yesterday, the 30th of July, which was great. It meant I didn't have to flog across to the other side of the country, and as a result I can speak to you today wearing my rubber trousers. The several things we discussed, but I think probably the most important was we had a very productive meeting with the Veterinary Medicines Director at the VMD, and we confirmed during that how Beaver has always interpreted the cascade is that it is there to support professionals in their choice of agent. And it is not there to restrict our choice. So if there is a similar agent, similar but different, which is licensed, that does not mean that with reasonable justification you can't choose the other agent. And we also established beyond doubt that cost is a consideration. Now, it's not the only consideration, but if we're in a situation where cost is limiting clinical treatment and probably animal welfare, typically because of the budget of the owner, then it is perfectly reasonable under the cascade to select the cheaper agent. We talked a bit about CANTER and responsible prescribing of parasiticides. There are, as you may know, attempts to make parasiticides prescription-only medicines, veterinary. One of the limitations here is, are vets any better at record keeping than suitably qualified people, SQPs? And it would be nice to think we are, and that all these agents are prescribed on an individual basis rather than just in bulk for a yard. But that is something to be tested. There was also discussion about who will host the CANTER guidelines. Currently they're hosted by Rumour. I think it would be only fair to say that when we're talking about who will host them, what we mean is who will pay for them. The MonitorME project is making excellent progress. This is our project to record antibiotic usage across equine practice in the UK. We now have the data from about 150,000 horses. Remember, there's only about 750,000 horses in the UK. And our antibiotic usage is just over 1.2 defined daily doses per year. So that means that the average horse in the UK receives antibiotics on 1.2 days of that year. And lastly, again, has been brought to our attention that there's been changes to West Nile virus testing just to make this much simpler and easier. You now can just get a West Nile test much like any other laboratory test. You don't have to declare suspicion, and there's not going to be a substantial extra investigation with sort of public health investigations or anything like that. You can just send in the blood sample if you think you just want to rule it out, and if it's negative, then there is no further complication. That was what we achieved yesterday. Thank you very much.